Hello, this is Melanie Didham, continuing with our development of our preceptors with the New Brunswick Critical Care Nursing Program. So this little discussion is about our preceptees. What should you expect out of a New Brunswick Critical Care Nursing Program preceptee? So the people who get into this program are novices to the critical care area. So they're not necessarily novice as a nurse. Some may be within a year of graduating, but these people come with a variety of backgrounds. Some of them come from a med-surg unit, some come from pediatric unit, or have only worked in certain areas of the hospital. So you aren't necessarily getting a new grad when you get a preceptee from the critical care nursing program. So there are 5 stages to your development as a critical care nurse, and I'm using Benner's stages of nursing proficiency. So Professional Benner, she applied nursing development of their clinical competence to a Dreyfus model of skill acquisition. So the 5 stages are your novice, your advanced beginner, your competent practitioner, leading to a proficient practitioner, and leading to an expert practitioner. So the Benner skill acquisition theory, she discussed implications for teaching and learning at each level. So there's a very strong focus during preceptorship. So each skill level has characteristics that have implications for teaching and learning within the nursing practice. So as I said previously, most of our students are at the novice level with the critical care skills and competencies. However, they may have higher skill or competencies in other areas of nursing. So, implications for teaching and learning. So, learning is evolutionary. Participation, repetition, and reinforcement strengthen and enhance your learning. Variety in learning activities increase your interest. Readiness to learn enhances your retention, and the immediate use of information and skills enhance your retention. So this is a movement from reliance on an abstract principle to the use of a past concrete experience. So you're moving from something abstract and developing into something that is a lot more concrete. It will change in the assessment of a critical situation from everything is critical towards the ability to assess the critical relevant parts of a situation. And it will lead to a change from the detached observer to an involved performer. So this is our goal with our development of our novice nurses. So a novice nurse is someone with no experience in the situations that they are expected to perform in. So the characteristics of these novices are they have limited practical skills and they rely on rules and expectations of others for direction. So they're pretty much a tell me what to do and I will do it, task-orientated type of person. And then they should progress into an advanced beginner. So those who have coped with enough real-life situations to note or have pointed out to them by a mentor and preceptor, develop a recurring meaningful situation component where they are aware of their potential outcomes. So they are marginally competent in their skills, they use theory and principles, they have some difficulty in establishing priorities still, and experiences begin to formulate and guide their actions. So they're beginning to become a little more comfortable in the critical care setting. Then your nurse progress into becoming a competent practitioner. So these competent practitioners usually have a plan, and the plan helps establish their perspective. And this helps them with their efficiency and organization skills, but it lacks speed and flexibility of the proficient RN. It's someone who can cope with changing clinical picture, but they may be a little slower and not quite so streamlined in doing it. So this is usually an RN with a 2 to 3 year experience in their critical care area. They feel competent and organized. They do have plans and they do set goals. They can think abstractly and analytically. and they will coordinate several tasks simultaneously. So they're becoming a little more comfortable in their skin. And this should lead us to the proficient practitioner. So these are people that have started to learn from their experiences what typical events can lead to an expected given situation and how to modify your plans in response to these events. So they have an improved decision-making ability. And to a novice or an advanced beginner, these recognition of issues and responses are very, very subtle. So they don't necessarily see these subtle changes, and so they're not easily understanding how you can go from A plus B equals C. They don't see the subtleties as a novice or a beginner. So proficient practitioner will see your patient holistically and will recognize these subtle changes and will establish priorities with ease. They can modify their plans and can focus on the long-term goals of your patient. So they can look beyond what they see. Now, when you get to your experts, these nurses have an enormous background of experience and now have an intuitive grasp on each situation. And they will zero in on the accurate region of the problem without any wasteful consideration of unfruitful alternative diagnoses and or solutions. So these nurses have a very deep understanding of the total situation. So these are usually critical care nurses with about 5 years of experience in their critical care area. They perform very fluidly. They grasp patient needs automatically, and responses are just integrated. And the expertise comes very naturally to them. So the goal of our preceptorship with this program is to aid our novice RN in transitioning towards an advanced beginner, okay? And you guys are going to help us do that with your excellent nursing skills and mentorship of our nursing students.